So this is a really important, I think, study in the Journal of Sexual Medicine, July of this year, 2017. And what these investigators did is they had two groups of men, 30 in one group and 16 in the sham side. And then they did penile triplex ultrasonography, and then they repeated it at 3 months after treatment. And then they assessed them at 6 months, 9 months, and 12 months. So studies have been done like this before. Here's one where they did the same thing, and other studies. And multiple studies now showing results. Like in this study, they showed results with improvement of erectile dysfunction scale after low-intensity shockwave therapy. But this one, they actually have an objective measure, and they measured blood flow. So let's think a little bit about how they applied it, and then I'll give the results. So if you look at the picture here, what they did was 300 shock waves here, 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 and here. So 5 locations. And if they did 300 waves at 160 shock waves per minute, then it takes about 20 minutes to treat one person. And you can see the energy there that they use. So it's about 1,500 shocks. And it sounds horrible, shocks, but if you've experienced this, which I have, it's like someone tapping you with their finger, and not even in a very hard way. It's just a tap. No pain control is needed at all. So here's what's exciting. If you look at this, here's baseline, 1 month. Here's erectile function scale. That's a huge jump from baseline to 1 month, from an average of around 12 or 15 up to around 20. And then if you look, that's sustained at a year. That's impressive. It's very impressive. And then here you go. That gives you a look at it in a bar graph. But this is what's really interesting to me, and this is what makes this study unique. Lots of studies showing benefit from shockwave therapy, but in this one, they show that maximum peak systolic velocity. And you don't have to look hard to see which one of these groups you want to be in. Obviously, there's some outliers. For example, in this active group, I don't know what happened here. And here's one where he's treated with a sham and he went up. Oh, he got a new girlfriend or something. I don't know what happened. But as a general rule, you can just see you want to be in this group, not this group. And that's at 3 months with sustaining benefits. So I don't belabor this. I just want to make you aware of it and let you know how we are doing this. Now, there's a protocol one of our private shop providers uses that is more aggressive than this, and but most of the people are using this protocol. Who knows what the right protocol is going to turn out to be? We're still in that phase where we're proving that it works and not developing yet the nuances of, or at least it hasn't been published yet, some of the nuances of what works best. The same way with the priapus shot. One of the urologists in our group published some findings showing decreased venous leak and increased arterial pressure at one of his big urology meetings with our priapus shot procedure. So the thing that's different about both of these versus what we have available, for example, Viagra or injecting a vasodilator, neither of those two things actually correct the problem. So what's exciting about this is we're getting to the place to where we're actually getting to the etiology. Now, notice that in this treatment group, this guy didn't get better. And nothing is 100%. Remember, 20% of the people in the hospital with pneumonia still die. But that does not mean antibiotics doesn't work. It just means that some people are more complicated. And so, for example, if someone has vascular disease in the iliacs, not getting good blood flow to the penis, or his testosterone levels in the dirt, then this is not going to work as well. Now, in this study, they selected out their inclusion and exclusion criterion, selected out supposedly for a lot of those things that would have sabotaged it. For example, radical prostatectomy can't be in the study. Penile anatomic abnormalities or hormonal abnormalities can't be in the study. But we don't want to simplify this and make our patients think that this happens to everybody. But jumping this much, that's a change in your life. So check it out. The links below here, I'll keep them updated where you can find providers who have this method, providers who can combine this method with a private shot. If you are a urologist or family practitioner, then I'll put links below the video about where you can find training and where you can buy the materials needed, where you can find materials to both do this procedure and materials and training to do the private shot in combination. It's the bomb.